Assalamualaikum warahmatullahi wabarakatuh, and a very good day I wish to Madam Rohana. I'm Izzat Izzuddin bin Ismail, and today I will be talking about how to handle patient complaints as a hospital manager. But first, let me talk about the main roles of hospital manager. Well, there are several roles and responsibilities of hospital manager, and some of those are set budget and departmental goals, strategize to improve efficiency and quality of care, oversee finances such as patient fees, billings, and fundraisings, communicate effectively with departments and staff regularly, ensure the facility's compliance with laws and regulations, represents the organization to investors or governing boards, oversee work schedules, supplies and budgets, and to also educate the community on important health topics. So now let us move on to our main topic. Well, handling patient complaints are one of the main roles of a hospital managers. Patients can be complaining about numerous things such as hospital fees, cost of treatment, waiting time, and many more. Therefore, we as a hospital manager, we need to equip ourselves with the skills needed to handle this situation. And we also need to train our staff, especially those at the front desk and those who are in the front lines, on how to diffuse this difficult situation and to also promote peace in the practice. So how are we going to do this? Well, first, one of the most effective ways on handling patient complaints is by being proactive. What does this mean is we as a hospital manager, we must not wait for the patients to come whining at us or their insurance companies. Instead, what we need to do is we need to ask them on how they are doing, and we need to do it frequently. We need to ask them directly, especially at the checkout. We can also ask them by giving them surveys, both offline and online, such as by email. Other than that, we can also have the attending physicians to ask them during their appointment. Next, the other ways to handle patient complaints is by addressing their concern. What does this mean is we need to pay attention to what the patients are telling us, and we need to address their issue. For example, if the patients are complaining about abnormally long waiting time, what we need to do is we can readjust the staff to accommodate with the patient flow. Other than that, for example, if a patient is complaining about having difficulties in sleeping on the hospital bed, what we can do is we can recheck whether the bed is a faulty unit. Furthermore, other ways on handling patient complaints is by listening attentively. Normally, patients who complain just want to vent out their frustrations, and they want to be heard, not to be interrupted or told to be calm, because this will only make things worse. Therefore, we as a hospital manager, we need to listen carefully and attentively to their complaints until they have finished speaking before adding anything into the conversation. We must never roll our eyes, tap our pen, or sigh deeply, because this might send a message that we are annoyed or impatient, and we absolutely do not want the patient to see us that way. And next, how to handle patient complaint is by speaking cautiously. After listening to the complaints, we need to pause and then speak with a calm tone. We must make sure that we understand the issue that is bothering our patient by restating their concerns. We must not tell the patients that they are totally wrong, because this will only agitate and anger them further. Moreover, other ways on handling patient complaints is by thickening our skin. In other words, we must not take the angry or irritable patient's grievances personally. What does this mean is we must not be easily offended or getting upset by their complaint. Instead, we need to ask ourselves, is our patient facing a certain health challenge? Because usually, anger is just an outward manifestation of fear. The next way on how to handle patient complaint is by being empathetic. What does this mean is we as a hospital manager, we need to try to put ourselves in the patient's position and try to understand them better. For example, we can ask questions like, are they in a lot of physical pain? Have they been ill for a while? Because patients who suffer from chronic diseases are easily agitated. Besides that, we can also ask questions like, are they having financial difficulties in paying bills? So by trying to understand their situation better, we can respond to them in a more positive manner. The next way on how to handle patient complaints is by apologizing. Apologizing to our patient is a way for us to validate their concerns. But this is not to be confused with taking the blame or responsibility. Instead, we need to see it as offering an empathetic way to connect with our patients. We can say something like, I'm so sorry you felt rushed at the appointment today. Can I take some of your questions and ask the nurse or doctors to call you back at the end of the day? So these are the kind of questions that will offer empathy plus a solution, which could be all it takes to calm a frustrated patient. And last but not least, how we as a hospital manager handles patient complaint is, what we can do is we need to document the complaint. We need to make sure that our staff is trained to document all complaints, no matter how small they are. Because one complaint today could lead to a second next month or next year. By documenting the issue and how we resolve it, we will leave a paper trail should we need to prove anything under litigation. So that's all from me on how to handle patient complaints as a hospital manager. Thank you, Madam Rohana, for spending your time to listen to my presentation. I wish you a very good day, and Assalamualaikum warahmatullahi wabarakatuh.